Hi, this is Dr. Porter. I'm going to demonstrate for you some exercises you can do to improve your back health. This can be used before surgery or after surgery especially. It's very important that you do some exercises after your back surgery. The rehab of your back is as important as rehabbing your knee or your hip after those types of surgery. Those that stick to the program are going to derive the greatest benefit from both your surgery and the rehab program. It's very important that you stay consistent, that you continue to do it. I recommend 4 to 5 times per week for 15 minutes. Those patients that only do it for a few weeks and then do nothing for several years and wonder why their back pain is returning or never went away, usually it's because from inadequate rehab. So I'm going to demonstrate here quickly a few exercises you can do. The first is a very simple exercise called a bicycle. You can sit on a chair or you can sit on your bed at home, and all you do is sit right up without bending your back. Lift your knees like you're on a bicycle in the air. Keep your hands on the table and start bicycling like you're in a seated bike. And I want you to do 25 of these and then take a rest. So one full rotation is 1 rep. Then you can rest. Then I want you to do 25 again. So that will be 2 sets. The next exercise would be the reverse bicycle. It's the same thing, but pretend like you're bicycling backwards. 2 sets of 25. The next exercise is in and out. Basically lift your knees up to your chest. You can do this in a chair and just kick your legs in and out, in and out, in and out, in and out. Those will all build your core, your front core abdominal muscles. The final exercise you can do is just laying down without even moving your back at all. Lift one leg off the table or off the bed and the other leg high. And this is called a scissor. And I want you to hold that for 3 seconds and then switch. Both legs are off the ground, your toes are pointing to the sky, and your heel on your lower leg's about 3 inches off the ground. Your upper leg is as high as you can get it. 25 of those 2 times. Now to build your lateral obliques, I want you to do what's called a V sit-up. So you lay on your side, your lower hand's down on the table, your upper arm's behind your head, and you do a sideways sit-up. So elbow up and down, and up and down. And as you get better at this, you can actually bring your feet up to your elbow and try and touch together. So my legs are straight, they're 30 degrees out, my toes are pointed up, and I bring my legs and my arm together. Up, 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 up. You can do 25 of those on both the left and right side. That will improve the strength of your obliques, which are part of your core muscles. Final exercise improves the strength of the extensors of your back, the extensors of the thoracic and lumbar spine. These include the lumbricals, the iliolumbar, the multifidus, the obliques, and the intertransverse muscles. This can be done very simply by putting your belly on top of a pillow. I recommend 3 pillows. And then you can put your hands behind your head and do a reverse sit-up and hold it. And hold it for 3 seconds. Up, 1, 2, 3, down. Up, 1, 2, 3, down. That'll improve the extensor muscles of your back. This is probably the most important exercise that you have to do after back surgery. You can do it also on a ball, and you can also add a variation to it, which is when you extend your arms out, and we call this a Superman. And down, out, and down. 1, 2, 3, and down. Do 25 of those 3 times daily, 4 to 5 times per week. The last variation is thumbs up, thumbs out, thumbs in, and down. And that's for a 3 count as well. 25 of those, 3 times a day, do any of those variations or all three. Again, the more you put into the rehab of your back after back surgery, the better outcome you'll have, the better posture, and the better pain control. If you have any questions or any of these exercises cause severe pain, stop doing them and call my office and we can talk about modification. Thanks.